Welcome to Rat Chat. I'm your host, Brandilynn, and today I'm going to bring you my surgery story. So this one's going to be about my poor little ear right here. My poor little ear surgery. So I'm making this video because I got a lot of people interested in my ear surgery. So why not bring it to YouTube, bring it to the masses? For everyone that follows me on Instagram knows that I got recently an ear surgery. Actually, probably a month ago. It was on March 4th to be exact. So I had a rare birth defect because I'm a rare bitch. I mean, let's really get into this, how rare I am. So I had this rare birth defect that is like in 0.7 people in America, 7% of people in America, and also it's more common in Asian Americans and African Americans, and I'm a basic white girl. The fuck did I get this for? So I'm telling you, rare. I'm a rare bitch. So I basically had a microscopic hole, really small, in my ear, which is why I'm wearing my hair up to show you guys. Well, it's just kind of far, but basically in this part of my ear, not in my ear hole, like not in the eardrum, on the layer of ear where like some people get piercings and stuff, I had like a microscopic hole. And what I mean by hole is literally a hole. So in this microscopic hole, basically the rare birth defect, they call it a pit. So I had a pit in my ear, and this pit basically formed its own sinus tract, like in my eardrum or inside the ear canal or wherever the fuck, inside some shit, because you can't see it, it's all in underneath the skin. So I had basically this pit formed its own sinus tract and just living simultaneously with my normal shit going on in the ear. I guess you're born with it as a baby, so I've always had this, never known. And they say that you only ever find out when there's a problem. And I had a problem. So I guess it's really always been there and I've never really noticed it, I never paid it no mind. Maybe it's been irritating and I just did not give a fuck. Like, I don't got time to worry about this shit. Fast forward to recent, before I actually like, you know, had like got it checked out and all this stuff, I did discover like a few months earlier that like, oh, I have a hole in my, like, what is this? Like, you know, I'm popping pimples one day and I'm like really hyper analyzing my face and I'm like, what is this? Like, that's weird. Like, what the fuck?
Oh my God, what is that?
And not to be disgusting, but this is gonna be real disgusting. So if you do not like disgusting, tune out now. But trigger warning, it's gonna get gross. So, and it's gonna get TMI. But I'm all good now, but tune out now if you don't like graphic details. But basically, the hole was like oozing some shit out of it. And I'm like super hygienic and clean. So I'm like, what the fuck? Literally, what the fuck? Like, what? Like, that's so disgusting. So I'm like, this is gross. You know, tried to fuck with it and like it was crazy. But then I guess maybe few weeks, few days, whatever time goes by, and then one day there's blood coming out of the hole, and I'm like, that is not good, because I'm the kind of person where I don't necessarily deal with things right away. Like, I push it off. I'm like, oh, I'm too busy, I don't have time for that, or like, I don't want to deal with that. Like, I'm just gonna pretend it never happened. So and who knows, maybe I've done that in past, like years and years, but like, I'm fucking whatever. I'm just like, I don't care, it's a hole, fuck it. And so then it started bleeding through this hole. And I'm telling you, the hole is so small. Like, it's like not a pimple because it's not raised. It's flush with my skin. So it's like in my skin, it's not raised. You wouldn't really, no one would ever notice it besides like it's on my body. So I noticed it. But then it starts bleeding. And I'm in bed and I'm like, I don't have fucking time for this bleeding ass ear. So I took hand sanitizer that was next to me and I put it on a little piece of tissue and put it in the ear, on the ear, and it burned the fucking shit out of my ear. And I'm like, that's not good. So I have a fucking oozy ear. Now it's bleeding, and now I just burned the shit out of it with hand sanitizer. So I'm really not doing well. And it hurt, it like really, and it scabbed, and then it was gross. I'm like, you know, I have really good insurance. I need to get this figured out. What the fuck is wrong with my ear? And I feel like also because of COVID and just becoming older, I'm more like nervous about stuff like that, or like I don't want to like have cancer and die, so like I should get shit checked out. And I suggest all of you go to your doctor and get things checked out if you don't feel right about them. PSA. Anyways, back to our regular scheduled program. So I go to the doctor and they, you know, obviously they see it's burned and they're like, what the fuck? And also, when you tell people you have a hole in your ear, people do not understand it. They think you literally have a hole in your ear, which is your eardrum. And no, I'm not talking about this hole. I'm not talking about this hole. I'm talking about there's a hole on my ear. Here's my ear cartilage, hole on my ear. I'll put pictures and fucking there'll be one here, there'll be one here, there'll be one down there. You'll see them. It's great times. But the fucking doctor first tries to check my eardrum, like thinking there's a hole in my eardrum, which, how would I know that? How would I know? If I'm calling you and I'm telling you there's a hole in my ear, how would I know that? How am I seeing in my eardrum? Fucking dude, like, use your brain. So the guy is going in my ear and he's like, I don't see any hole, but you know, I can see that you use Q-tips really aggressively. To tell you that I really fucking clean my shit. Like, I'm super clean. Like, so the fact that this even happened was super stressful in my life because, like, disgusting. So I'm like, dude, okay, yes, I use Q-tips in my ear. Maybe I'm not supposed to, but like, I'm not talking about there. And then I'm like, I'm talking about on my ear. So then finally he goes, oh, you just have a preauricular pit. Like, no big deal. I'm like, okay, so I'm thinking it's like no big deal. He goes, oh, that's a minor surgery. We'll just take it out real quick and no big deal. He's like, oh, I'll fit you in with my other surgeries of the day. So I'm thinking like, that's fucking awesome. Like, okay, we're just gonna like get this shit done, right? Like, it's gonna be easy peasy. It did not go easy peasy. I'm thinking that it's just a minor surgery, no big deal. I had to take COVID tests a week before. I had to do my blood work 2 weeks before. I did all the pre-measures. Everything was good. I was negative on COVID. My blood work was fine. Surgery set. I have not went to the hospital since I was young. I used to be in the hospital a lot when I was young. I've got tons of fucking stitches in my life, but I was young and like you just, you know, you're young. You don't really heal from it because you're so young, you don't remember, or you don't, you know, it doesn't ruin your life because you're young and you can heal fast. But yeah. So I haven't been in hospital since I was really young, and I just didn't think I understood that like a surgery is still a surgery, even if it's minor. In my mind, I'm thinking like, oh, I don't know, maybe they'll take a big needle, like put it through this little hole, take the needle out, done. I don't know if that was naive or when someone tells you it's a minor surgery, you just don't think into it. But holy shit, this was a whole fucking production. March 4th on a Thursday, as Always Sunny would say. I go to my surgery, I report to my surgery, and I bring my work laptop thinking like, this will be easy, I'll be fine. Boy, was I wrong. You do all your paperwork, you get there, and then they're like, okay, you're gonna get put into like the pre-room where they're gonna just answer more questions and like, what are my belongings, what do I have with me? And I'm like, oh my god, it's a lot of questions I'm answering, like shit. And then, so I'm sitting there, and mind you, this is all an outpatient center, not an actual hospital. So I'm also thinking it's not gonna be as serious because I'm not in a hospital, I'm just in like an outpatient. It's like a mini hospital, so fucking, why don't they call it a hospital? They then transferred me to my little bedroom thing where you're like enclosed with a curtain and I have a bed, and I'm thinking like, oh, like, I don't know, I just didn't think I would have to do any of this. So then they like, okay, like put the gown on, put your the cap on, and like put your belongings away, and basically like sit here basically just like in my gown. So I'm like, okay, so I'm sitting there, and mind you, it has not hit me yet of like nerves. And people ask me like, oh, am I nervous? I wasn't really nervous. Nothing really hit me yet. And then as I'm like stirring there, and then this other nurse comes in and she's like, okay, well the doctor will be here soon, just blah blah blah. And another nurse comes in and says, okay, when you're post surgery, you'll come to this side of the wing and I'll be dealing with you. I'm like, okay. So then as I'm sitting there, all these nurses are coming in and like you're like waiting, and you're like, holy shit, like this is really more serious than I thought. Like I didn't even think I would have to be in a gown and cap. So I'm like, okay. So then it's finally my turn, and the nerves are building now. Like I'm pretty nervous now. Like, oh wow, this is not what I expected. And then this poor like older nurse who was like so tiny, she's trying to push my bed and she keeps knocking me into shit in the walls. I'm like, oh my gosh, like this is just not going well for me. And then finally get put in the surgery room and you're like, holy shit, like I'm in the fucking surgery room. And this is where my life went dark. So you're on your like thicker type bed, and then they want you to transfer to the small skinny bed. So I'm like shuffling into the bed, and then because they only want to see the area they want to do surgery on, which I have seen in television shows, I knew that would happen. So I'm like, okay. So then they're like, okay, well, we want you to be comfortable, so we'll have you tuck this arm and this arm can stay out. But then the nurse like forces your head to one side, so I'm laying on this bed like a fucking burrito because they cloth you in with the blankets and like shove you in. I'm literally like a stuffed fucking burrito. And so I'm like, I can't really move also because, mind you, I did not go under anesthesia. I only had a local anesthesia on the area of my ear, but we'll talk about that. So I know I really cannot move because like I'm not under anesthesia, so if I move and they're working on such a small area, like I'm effed basically. I'm nervous about that because I'm like, I can't move, but I'm sausaged in. The only thing exposed are my little toes. Also, I'm wearing a mask, right? I think I can take the mask off once I'm in the surgery so I can breathe. No, you can't. They take your mask, and because it's my ear getting surgery on, they unlooped it and taped it to my mouth. So I still have a mask on. So head concoct, mask is on, I'm in the blankets, my one arm is kind of hanging out, this one's completely tucked, and then they put more blankets on top, and then they start putting the like surgical like blue papers, like not blankets but like paper, I don't know, like the surgical shit on top of me, like kind of the stuff at the dentist you wear here, but like it's all over my body. So, and then I'm also hooked up to all these goddamn wires. I have wires up my fucking fingers, I have wires in my back, I have wires everywhere, and I've never really experienced that either, so I'm freaked out too. And then they put this cold pack on your stomach and it's freezing, and the lady goes, this is gonna be the hardest part of the whole surgery, the cold pack. Bitch was wrong, that was the fucking easiest part. So I'm hooked up to all these wires and connections and all this fucking shit. I feel them put the fucking shit on top of me. So one, I'm layered on top of all this stuff. I can't breathe, I have a mask on. Then they like completely cover my whole head and then just my ears exposed. You feel them put their tools on your body, and I can feel them like put the tools on me, and you just feel so fucking creepy. Like you can't see anything, you're like dark and hollow, and you're just like fucking, you can't move, you're stuck in a position. And then I hear the monitor of my vitals, and I feel like it's like the movies, like I'm flatlining because I can't breathe, but then I'm aware that I can't breathe. So then I hear the fucking monitor basically telling me I can't breathe, and I'm worried the doctor's gonna be like, this patient ain't breathing. So basically the whole surgery in my head, I'm freaking out because I'm like, I gotta breathe, I can't breathe, I gotta breathe so they don't think I'm dying, but I can't breathe. I hear the monitor telling me so I was so anxious from like breathing, not breathing, monitor sounds, the people like I probably would have just like exploded eventually if it went on any longer because it was so anxiety ridden. I like, oh my god, it was so bad. And then the surgery starts, and to me they're like, oh, it's no big deal, like it's minor, whatever, it'll be quick. The surgery took way longer than I guess it was supposed to, and the local anesthesia they put on, like, yes, I didn't feel it at the very beginning, but they had to go deeper into my ear apparently because the cyst, which then gets formed from the sinus tract that this random pit forms, was so deep into my ear that they had to fucking like drill deep into the shit. So let me just get graphic now. I don't know exactly what they did medically, terminology-wise, tool-wise, but I'll just tell you what I felt like it was like and the smell. So first, I think that they're drilling my ear, like drilling into it, and you clearly know they're cutting it. I actually didn't know they were cutting it until you see your ear and how stitched it is, but I thought they were drilling into it. Like I could feel them drilling, and then it felt like welding because it would like, you smell the sparks, and I'm telling you, there's no feeling like smelling your flesh to a burnt like medical tools. The two combinations together, the smell is horrifying, the sound is horrifying. Mind you, this is all on my ear, so my eardrum can hear everything happening. Like everything is intensified because my eardrum is picking it up. So it's even more nerve-wracking. So I'm like, holy fucking shit. So it feels like drilling and welding and like cauterizing, and they're pouring iodine on me. And then you're like, oh my god, this is ever gonna end. And it was so, they're going so deep in it, and I guess they're cutting too, and they're fucking scalpels looking for shit in there. And mind you, it's so tiny that I'm like, what the fuck, how is this happening? And the experience went on for what felt like an eternity. It was like, I don't know exactly how long, like a half an hour, 45 minutes, an hour, but the drilling and the welding or whatever they were doing was so crude. Like, oh my god. Oh my god. At one point, I was in so much pain that my poor little toes at the end were like, just like, I could only move like 3 toes, and they were like clenching each other because I couldn't move my body because I'm so terrified of moving that my little toes at the end of the fucking bed were like trying to like grasp each other because I was in so much pain. It was excruciating because that fucking anesthesia wore off, or I don't know, but I felt everything. So then they're like, wow, I can hear them talking. I'm like, that's really deep in there. What? And then finally they get it, and they're like so excited, and I'm over here like, I'm crying almost, like, but you're not actually crying, you're like silently crying, like, oh my god, can you like get it? So I guess they finally get it, that they had to go super deep. And then what I found out was that it was so deep that when they had to stitch my ear up, they had to do cross stitches, which I didn't find out till like a week ago. But they had to do cross sections of stitches. Then they're like, oh, also too, they have to like, once they got the cyst out, they had to like drain, like put water through it to like drain out everything. So then the fucking doctor is trying to clog my eardrum so water doesn't go down my eardrum. Of course water gets in, and then you're like, you feel the water in your eardrum, but I also could feel the water in the sinus pit, and I'm like, that was so fucking weird. And you're like when is this gonna ever fucking end? It felt like literally my life, like it was like flash before its eyes. It was so painful. And the smell, guys, like was so bad, like medical tools coming together with like burnt flesh, and it's like, again, it's just disgusting. And then you hear the sparks flying, you hear the like, it was just so bad. So then they're like, okay, we're gonna stitch it up now. Mind you, my eardrum is right here, so when they're stitching right here, I can hear every single stroke of the thread and the fucking tightening of the thread. I can hear it sliding into the fucking ear, and that was traumatizing in itself. To like hear your own ear get stitched was like so traumatizing. So that was an experience. And then, so you're like, okay, fuck it. Then finally they like stitch it all up and whatever. And then the surgeon leaves, and then the actual doctor is like, oh, you want to see it? And then he shows me the cyst in the little can thing, and I'm telling you, so this hole, I'm telling you, was microscopic. The cyst they pulled out of the fucking hole was like a fucking rock, like a cratery looking rock, and they said it was so deep in my ear canal, and it was so scar tissued that it was like fucking hard to get out. So now I'm like fucking worried, because another reason you have to, so if you have this rare birth defect, what my doctors told me was you immediately, if you have something wrong with it or an issue persists, then you have to get surgery because it could have cancerous cells. So here I am, 26, like scar tissued up, it's super deep in my ear. I'm like, oh my god, I'm gonna have cancer, like it's gonna get tested for cancer and I'm gonna die. And then so you know when you get the surgery that it's gonna get a biopsy and get tested for cancer, and you're like for weeks like, holy fuck, do I have cancer? Luckily I do not have cancer. It was a benign cyst, thank the fucking Lord. But for a couple weeks you don't know, and that's super scary too. Especially when you see it with your own eyes, a foreign object like underneath a layer you don't see. Like how would you could never see into your ear, like you don't know what the fuck's going on in there. So that was just, so then you get put into the like post-surgery little bed, and they're going over everything. Like I couldn't get my ear wet for 3 days, and if you know me, like I said, very hygienic. I have to wash my hair every day. So the fact that I had to like, they told me I couldn't get it wet, I was like, how can I not get it wet? So I basically had to plastic wrap my whole fucking ear, tape it up and make this whole little dome, and then thank God my shower head comes off, because then I had to like do this weird little tilt thing for fucking 3 days. And it was a fucking horrible 3 days, but the first day I could get it wet, it's also weird because then you have stitches. So I had 2 layers of stitches. I had a layer deep within the ear of dissolvable stitches that were like cross-hatched, and then I had the layer you could see that was like the big stitches, like you can't get them wet, they gotta be removed. And I think they were removed for like a week or 2 after the surgery. So yeah, so you realize basic shit you do, like the simple pleasures of life. Like it made me really depressed because you think like I couldn't just take a shirt off because I would bump my ear. I couldn't just shower normally and like scrub my hair, or I couldn't just have my hair down because my hair would get stuck in the stitches, or it would get in the ointment that I had to put on it so it didn't get fucking infected. And then you have to put that shit on it like twice a day, and you have to take, I had to take 4 pills of fucking, what are they called? Like, I don't even know. The like making sure, and like the fucking pills you take so you don't get an infection. So I had to take those 4 pills a day to make sure no infection came. So that's a lot of pills. It was just so crazy, and you really take advantage for simple things. Like I could only sleep on this side, and I could only sleep on, because I sleep on my side, so I can only sleep on this side from my ear, but this is the side I prefer to sleep on. I'm more comfortable on this side. So for so it is now, today is like April 10th I'm recording this, and I've just been able to finally like sleep on this side, and it's still painful. I've had the actual stitches removed. I have just 1 dissolvable stitch left that's still in there. It hurts. 1 just fell out, but my ear is still super numb. Like putting pressure right here, like I feel it. It's super numb. It's super ugly. Definitely scarring. It's just disgusting. And then the whole experience of being and like knowing my ear is so ugly, and I felt so down about it. Then you go through this whole like post surgery thing, because I was working out every day, and then I couldn't get it wet, so I couldn't really like get sweaty, so then I couldn't work out for a couple days. Then it's like when I did work out, I had to be careful like with like pulling on it or like rubbing sweat off me, and you just kind of get depressive. I can't just do simple basic shit. And yeah, and so finally I'm like out of it. Just, you know, I'm in recovery. It's healed basically. It's healing basically. But yeah, it was so fucking crazy. I do not suggest anyone ever get this or have to get an ear surgery, and make sure you really pay attention to your body. I mean, I probably could have taken care of this maybe years, months ago and been a little better, but you know, pay attention to your bodies. You never know what something could be. Go to the doctor if you feel necessary. And yeah, that was my ear surgery story. So if you want to hear any other random stories, if you have any questions, comments, leave it in the comments below. Subscribe to my channel. Check out my interviews with people. Check out my segments. If you like these little random rants, I'll do more, but let me know. And like always, have a magical day. Bye.